let's talk about defining pain. I think we all have an idea of what pain means to us and what our own unique perception is of pain. We might even project our own perception of pain onto others or make assumptions about what their perceptual experience is with their own pain. And so let's look to the folks that study pain to hop into a definition of pain. People that study pain, the science of pain, are called dolorologists, and they agree on some definitions, although I would say they might argue about it quite a bit. I don't think anyone is really accepting these definitions as 100% satisfactory, but sort of what we can do at this point with the state of the field. And so if you go to the International Association for the Study of Pain website, which is a really large group of folks that are pain scientists and pain practice, pain education, science communicators, folks that are interested in dolorology, they have a list of terminology. And we should probably start with nociception. So nociception is encoding noxious stimuli. So these are aversive stimuli that are in our environment, and there's a physiological and neurological process associated with encoding these stimuli. But nociception is not the same as pain. Pain is a complex perceptual and psychological phenomenon, and the agreed upon definition with the IASP folks is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So a few things about this. We don't actually have to have a notable potential tissue damage. Sometimes there's pain in the absence of what is clear potential tissue damage. And I also want to point out the note here that pain is a sensory and emotional experience, and I'll talk to you more about that in a minute. But some of the keynotes from the IASP for this include that pain is always a personalized experience. There's really no way to objectively measure pain. You can't put someone in a scanner or take a blood test that tells you exactly how much pain they're experiencing. We all have our own subjective benchmarks for this. There are widely validated pain scales for measuring pain. I'll talk to you about one of those in a minute. But many things might influence somebody's perception of their own pain, including biological factors, psychological input, and social factors. So one notable example of social factors is the gender difference in reporting of pain. Again, I just want to note that pain and nociception are different phenomena. So nociception is encoding that noxious stimuli, while pain is multidimensional and includes both sensory and emotional input. And another note here from the IASP is that a person's report of their own pain should be respected. Because there is no objective way to measure it, and because we have a moral imperative to reduce suffering where possible, we should take someone's own subjective pain rating as fact, right? So that's the state of the field. And when I say we, I don't mean me, because I don't work with patients. I work in basic science in a research lab. But that's something that I think that we can all agree on. So getting us started, those are definitions of dolorology, nociception, and pain. It's actually not easy to come up with a definition of pain. You can think about what pain means to you in reference to this definition. But because pain is multidimensional, finding ways to measure it with scales has been a great challenge, but one of my favorites and certainly the most widely used is the McGill Pain Questionnaire. And this is from Dr. Ronald Melzack. And you can see here the short form questionnaire has questions about the sensory and emotional experience that someone is having with pain. So this really underscores the multidimensional nature of pain. So some of the sensory words is your pain throbbing? Is it shooting? Is it stabbing? Is it sharp? And so when we think about the sensory nature of pain or the sensory dimension of pain, what we're talking about is the nervous system processing the basic qualities of a sensory nature. So where's the pain located? What's the quality of the pain as far as its modality? Is it sharp? Is it cramping? Is it gnawing? Is it burning me? Is it stabbing me? And then the emotional dimension of pain is the unpleasantness of the pain. Is it tiring? Is it fearful? Is it sickening? Is it punishing? Is it cruel? So these are things that have an emotional valence. And so that's an example of one of the most widely used pain questionnaires. And I also want to show you that within this, we usually rate our pain on a scale. Like you might go into the doctor's office and be asked either on a form, there's a picture on a wall, or they say just verbally, what's your pain from 0 to 10? I actually have a new shirt. I forgot to wear it today. I just realized that. It's like, what? How can you rate your pain from 0 to 10? And this is part of pain measurement and pain assessment with patients. And while that may seem really perfunctory and basic, it actually is a decent way to get the conversation going, and people can assess their own pain and their own psychological interpretation of what they're experiencing. And what's nice about that, including the one with faces, is that you may even be able to use it with children and with folks that are nonverbal or folks that speak a different language than you, right? So it can be pretty useful. And as far as thinking about pain as multidimensional, I think that pain is very complex. There's a great deal of research that's been done already. There's a lot more that needs to be done, but it's a super exciting field, right? And one of the most exciting things is that there is a wealth of research about the various brain areas that are involved in processing the sensory versus the emotional nature of pain. That's something that I get really excited about. But I will see you more in the next chapter.